Okay, this is our international health project. The preliminary report for our project is on Delhi, India, the world's most toxic air, and with myself, Ashley Beck, Desiree Aguilar, Jordi Zimmerman, and Trudy Yount. The problem that we are trying to solve is the air pollution in Delhi, India. So Delhi, India has the world's most toxic air, which is posing health threats on the population. Although some inhabitants have begun to wear surgical masks, many still remain uneducated about the seriousness of the issue, and their health suffers as a result. The toxic pollution comes from coal-fired power plants, construction dust, crop burning, cooking fuel, and cars. The World Health Organization released data on air quality in 2014, and out of 1,600 cities, Delhi was found to have the highest concentration of particulate matter smaller than PM 2.5, which is 2.5 micrometers. And these particles are so small they can evade the body's defenses, penetrating deep into the lungs, causing chronic health problems. And they have also been linked to heart disease, stroke, increased risk of asthma, respiratory infections, and cancer of the trachea, lung, and bronchus. As a result of the toxic air Delhi suffers from, the country has the world's highest death rate from chronic respiratory diseases, as well as more deaths from asthma than any other nation. And Trudy was actually able to interview a man from India, and one of the most important questions that she asked him was, do you think the pollution and air quality in India are as bad as we hear in the media? Does everyone there wear filtered masks? And what do you see as some of the biggest health problems there? And he responded saying, yes, air pollution is a huge issue in bigger cities, but almost non-existent once you leave the big cities. The biggest problems we see with this issue is the lack of education. This creates a lot of health issues because the general population has not changed certain habits. For example, factories are still burning plastic, the workers are not wearing masks, etc. I have yet to encounter anyone who wears a mask because they do not understand the implication that air quality has on their health. The government does nothing to educate the population. Water pollution is also an issue. Getting a gallon of filtered water can cost from 1 to 3 days of pay for most people. This I find to be mind-boggling. I think the only way to reduce pollution is to educate people not to burn their garbage and to push government officials on environmental issues. India is getting smarter, but unfortunately it will take far too long for it to make a difference in my life.
So what is our plan to fix this issue? We've concluded that education is the biggest key to our solution. As many Indians are not highly educated on air pollution and the dangers it poses, it is something we will implement into the education system so that the schools and children will be educated on what precautions they need to take and the reasons behind them. Also, the second part of our solution comes with providing these schools and children with the means to protect themselves. Education isn't enough if they do not have the means. This is why we're going to help and provide the children with protective masks so they can protect themselves. We know this will work because the air pollution problem in India will not be solved, and at least not in the near future. It will take a lot of time. However, our solution will help move this process along because by educating these children, they will be able to know of the dangers and this knowledge will be spread. By having the knowledge, Indians will be able to look forward to a new life and be able to seek for new ways of production in order to provide safer air. As we will be giving them the means to protect themselves, this will allow for Indians to be healthier.
How we plan on implementing this is that our target population for this project are the schools in New Delhi, India. And they speak English, so we would easily be able to communicate with them. They are lacking in education on the severity of the air quality and how it can affect their health. We will make a pamphlet of information in hopes that the children will take it home to their parents to read as well. Children respond to visual education as well, so we will give them a video presentation that they can watch, and we will also create an activity to get the children involved in their learning. We will provide each of the children in the school with a mask. We need to teach them how it could benefit them and how to wear them. And there's a greater chance that these kids will wear a mask if all of their peers are wearing them too. We will teach them how certain plants can be beneficial in helping to improve the air quality. This could be implemented into the school science program as a project, and they can grow and keep these plants thriving in their school. The state of California has adopted a policy of setting air quality standards in their schools. When the air quality is below a certain level, they stay indoors. However, we realize that it doesn't do any good to stay indoors if they don't have air filters in their school. So we're hoping to implement a plan using the same sort of idea. You know, if there's a certain air quality, they need to stay inside. The air pollution is a huge problem in New Delhi, India, and things will probably not get better until the government takes action. But we can start by trying to help these kids stay as healthy as possible in this situation. The kids are their future, so we're trying to start with them. And most kids tend to talk to their parents about what they're learning in school, so ultimately this information will reach some of the adults as well.